we're talking about the shoulder, we have to talk about the glenohumeral joint. That's what makes up the shoulder joint. That's our classic ball and socket between the head of the humerus and the glenoid fossa of the scapula. The actual glenoid, so what makes up the socket, is going to be your glenoid labrum, which is kind of like a web-like ligamentous, cartilaginous structure right there. It provides static stability at the joint. Then you have your anterior, posterior, inferior joint capsule that also helps with static stability. Then you also have your glenohumeral ligaments, your superior, middle, inferior, and posterior glenohumeral ligaments. Then, if we're talking musculature, you have your rotator cuff, which is your infraspinatus, your teres minor, your subscapularis, and your supraspinatus. And then, if we're talking also about the shoulder, we have to talk about the scapulothoracic joint or articulation. It's not really a joint, it's more of articulation because the scapula just kind of glides on the upper part of the rib cage as well as the thoracic spine. But it's very crucial to the movement and biomechanics of the shoulder because you have something called the scapulohumeral rhythm, which is basically that says for every 2 degrees occurring at the ball and socket, the glenohumeral joint, we need at least 1 degree of scapula, aka shoulder blade, upward rotation. So the two have to work hand in hand, basically, to achieve full forward elevation of the arm, elevation of the arm from the side, all of that stuff. But those are kind of your basics. Also, the muscles that control the shoulder blade are what referred to as your scapula or shoulder girdle muscles, and these are any muscles that have some sort of attachment to the scapula and cause movement at the scapula. So, you got your pec minor, you got your lats, you got your mid trap, your low trap, your upper trap. You got your rhomboids in there as well. So pretty much any muscle that controls your serratus anterior that has some sort of function going on at the shoulder blade would be considered kind of a shoulder girdle scapular muscle.
Hmm.
So that's a brief little anatomy rundown of the shoulder itself right there.